Hey everyone, it's Crystal here at the AAFE Training Center, and today I am treating a patient with neurotoxin. This is a patient of mine who I have been treating for almost 4 years now. So I pretty much know her dosing, and she pretty much gets the same thing every time we treat her because we know it works for her. So you can see, even though I have treated this patient for the last 4 years, I still mark her up every time I inject. And I do this for the majority of my patients. If I'm doing like a quick enhancement or something, I may not always mark up the patient, but typically 9 times out of 10, I am marking up the patient so that I know exactly where I'm going. So as you can see, we are starting with her frontalis, evenly distributing the neurotoxin across the entire muscle to ensure she doesn't spock. And you can see I added those 2 extra dots at the top because of where her frontalis bifurcates. Her hairline goes back a little bit further, so ensuring that that area is treated, because when she raised her eyebrows, I did still see some movement there. So I just want to make sure that it's evenly treated. So going across the entire forehead, making sure to evenly give the same amount in all of my dots so that she gets nice even distribution. Then we're moving down to the glabella. So you can see that I am treating obviously her procerus and then a medial and lateral injection in each corrugator. I typically like to keep my lateral injection pretty superficial, and I am using a tight dilution for this area. I've really been liking the results I get from a tight dilution in the glabella, so I typically keep that area tight and don't add any more saline. Next, moving to the crow's feet. So you can see she's getting 3 injections per side. This is what I've always done for her. This is what works for her. I always pull up my neurotoxin in 2 separate syringes and always injecting up and away from the eye. Then moving down to the lower face, the mentalis I think is a very underrated injection and something that I think most patients need done. And then moving down to the DAO. These 2 areas alone really help to solidify a full face neurotoxin. If patients aren't willing to do all of the other areas, at least getting that mentalis and DAO will keep their face symmetrical in terms of neurotoxin results. So now I'm just cleaning her off and she will be good to go. I will see her back in 3 months for her next treatment. Thanks so much for watching, everyone.